Let's talk to Dr. Layla McCay, who's Director at the NHS Confederation, about the latest on coronavirus. Good morning to you, Layla.
Good morning.
Coronavirus, again, is not even on some of the front pages today. You'd think we weren't even facing lockdown and national chaos and huge numbers of deaths as a result of the pandemic, but sadly that's not the case. But let's talk about the test and trace system. Announcement from Matt Hancock, the Health Secretary, and Dido Harding, who's in charge of the test and trace yesterday, which showed that 31,000 new contacts had been traced by the system, but a third of those who tested positive didn't give their contacts. How worried are you in the NHS that so many people are not willing to give their contacts?
Well, I do think it's worrying because a functional test and trace system is really at the heart of being able to ease some of the lockdown restrictions that we're starting to see. So what we need is a system that is very clearly working. We were promised, of course, this world-beating test and trace program by the 1st of June. Clearly that's not what's happened. But I suppose on the positive side, it is at least reassuring to see that the system is starting to work.
Yes, indeed. Starting to work, but perhaps people are a bit worried that it's not working quite far enough. And what do you make of this, the battles over the 2-metre rule now? SAGE, the committee that advises the government, government constantly said, look, SAGE say we have to stick to a 2-metre rule, not a 1-metre rule, which most of the rest of the world, including the World Health Organization, is doing. SAGE now, they've batted it back to the politicians, saying this is fundamentally a political decision.
Yeah, I think it's a complicated matter. As we know, the risk of transmitting coronavirus the risk increases the closer that you get. And where you're going to draw that line is, of course, a decision that needs to be informed by both the science and other matters. But what we're seeing here is that we've still got a relatively high amount of cases coming in every day. People are still dying of this every day. At the same time, we are reducing the restrictions. People are getting out and about more. And if we think about this in the context of protecting the NHS, then we really need to think about reducing restrictions, reducing these things in a very, very careful way. So chopping a 2-metre rule would need to have a lot of thought behind it, because that would be coming at the same time that we were reducing lots of other safeguards, and those things could stack up to cause problems. So I hope that whoever is thinking about this is thinking very carefully about it and not just doing it without the proper analysis of what it might mean.
Yeah, I mean, that's the thing, isn't it? And also, masks, there's a new study on masks, which the Germans say that as a result of when they introduce masks in shops and on public transport, they say they think that real world evidence has shown that they slowed the spread of the virus by 40%. This is the first study to give sort of incontrovertible evidence that the masks do actually make a difference in the real world. But we've been constantly told, have we not, that actually the evidence isn't really that clear cut. What are we supposed to make of that?
Well, I think that the evidence that had existed for masks had been really focused on something a little bit different. So lots of the past research that had been done on masks was about the extent to which they protected the wearer of the masks. And we know that unless you have a very high medical grade of mask, wearing a mask does not completely protect you from the virus. But actually, what we're now talking about, now that this is a widespread population effort, what we're talking about is protecting other people. And that's a different sort of function of the mask. And the research on that until recently has been much less. So it's not surprising that we don't have the full amount of research to fully understand the impact. I think it's really important that studies like this are coming out, because they're helping us to understand, and they're helping us to have more evidence and data and research when we're making those decisions. But what is clear is that there is clearly some kind of impact in a positive way of wearing face coverings in public places, and that's certainly worth looking at.
Yeah, absolutely. Can I also ask you about the National Audit Office report this morning, just finally? It's published by a body. Again, they've often exposed an awful lot of things that have gone wrong in government. They look at where the money's spent, who's spending the money, and they've reported not only that officials failed to stockpile PPE even after they were aware of the pandemic in China. We're talking mid-late February. They still were not stockpiling, making sure we had more gowns and visors, and that meant less than half of the PPE that we needed in this country was actually available. But also at the height of the pandemic, pandemic, in April, 25,000 elderly patients in hospital were discharged, nearly always back to care homes from where they'd already been, but they were discharged to care homes without being tested for coronavirus. And we have seen huge numbers of deaths in care homes from coronavirus. Maybe will be up to 50% of our total deaths. There's no excuse for this at all. Is that we already had an antigen test at the time. To not have tested patients before putting them into a care home scenario was basically a death toll for many in the care homes, wasn't it?
I think that what we've seen over the last months is that there were not enough tests available at the beginning, and that was really something that was being amped up really rapidly. But certainly we have been calling all along for more tests to be available. And I think that there are lots of different factors behind the tragedy that we have seen in care homes. But I think that really good standards of infection control and really thinking through all these different transmission routes is absolutely critical, and certainly it is a great relief to see that our testing capacity in the UK has very much increased from where it was.
Okay, thank you very much indeed, Dr. Layla McCay, Director at the NHS Confederation. Appreciate your time.